Hello everyone. Can you guys hear me?
Yes, doctor.
All right. So let me share my screen. All right. So today we are going to start microbiology. Okay. Since a lot of students yesterday um, brought some concerns about the tutor, so we have delayed the hematology module. So we'll first do the microbiology and then we'll do. Also, if you guys would like, what we can do is we can do both of these modules side by side. Okay, so like we will have a 2 hour session for the hematology module with one tutor, and then the microbiology with another tutor, like 1 hour session. So we can go both ways. Okay. So what do you guys think?
I'm fine with it, sir. I don't know about others. For me, it's okay.
Actually, microbiology, it's kind of an extensive subject. And also it's very exhausting, and a lot of students actually tend to forget it easily since there are hundreds and hundreds of bacteria and fungi. And doing like rushing through these things, there are a lot of information. It's one of the heavily and high yield tested subjects on the step one exams. You're going to get around 10% of the questions on microbiology itself. Okay. So rushing through microbiology would not be good. So what I recommend is we can do both side by side. Like we will do around 3 4 bacterias every day. Okay. Since there are around 300 MCQs in the Uworld. So there are on Uworld, if you have seen, there are actually MCQs for the infectious diseases, and then there are some MCQs. A lot of MCQs are actually distributed in different subjects. Like there are MCQs for on some bacteria in pulmonology, then there are in hematology, and a lot of system gastro. A lot of MCQs are in gastro, right? So we will try to do all of them, which is it's kind of very difficult to collect all the MCQs. Okay, since like it's actually sample to do like to make a study plan for the infectious diseases, but collecting MCQs from different subjects, and they are haphazardly distributed in all of the subjects, so it's really difficult. But we will try our best to do all of them. Like there are around, I guess, around 120 MCQs distributed in different subjects, right? but we'll try to do all of them. Okay. Um, so for microbiology, the recommended resources are sketch microbiology. Okay. Since micro is kind of extensive and you tend to forget them easily. So Sketchy is actually an amazing resource, but it actually requires multiple revision. It doesn't. If you do it one time, it's not gonna help you. So doing it multiple time, giving it multiple revision throughout the course will help you retain all the information. Okay, and also the best way to retain all of the micro is integrating the on-key flashcard practice, which we have already told you. Okay, so try to start on-key. Um, do it for the sketchy microbiology. If you're not using sketchy, do it for first aid, which is actually very must. Okay. All right. So today we are going to do, we'll try to cover most of the gram positive cocci, okay? And let me share the schedule with you. We are going to follow the sketchy microbiology pattern, okay? Something we have shared. Yeah, this is the schedule again. Um, Let me share in the group. So we'll follow this sketchy microbiology table of contents. Today we'll do the gram-positive cocci and then gram-positive bacilli. And moving forward, we'll do all these things. Okay. All right. Starting with the gram-positive cocci. All right. So, do you guys have any questions before starting the lecture?
Are you gonna be giving the lecture now and further?
Yeah, I'm going to be your tutor for the microbiology section.
Oh, okay. How many days this one?
So if we do only the micro part, then it's gonna take around 10 days, something around like 300 MCQs, right?
Okay. Thank you.
Right, no problem. So let's start our session. Who is going to read this question?
Which of the
Okay.
following processes is most essential in the pathogenesis of this patient's current condition? A 26-year-old man is brought to the emergency department due to fever and lethargy. His girlfriend says that the patient abruptly began experiencing fever, chills, vomiting, and diarrhea several hours ago, which were quickly followed by lightheadedness and lethargy. He has no prior medical condition other than an episode of epistaxis after a bar fight 3 days ago. The patient does not smoke cigarette or use injection drugs. There is no history of exposure to sick content, and he has not eaten anything out of the ordinary. Temperature is 38.9 Celsius and blood pressure is 90/60 and pulse is 120. Physical examination showed diffuse erythematous rash. There is an anterior nasal peaking in the left nostril, in removal of which show mild mucosal erythema with purulent discharge. Cardiopulmonary and abdominal examination reveals no abnormalities and sign of meningeal agitation are absent. Which of the following process is most essential in pathogenesis of this patient's current condition?
All right. So what do you guys think this person is experiencing? Um, any clues from the stem?
Yes, sir. The anterior nasal packing.
Yeah, but
Toxic shock.
yeah, but regarding like the signs and symptoms the patient presented with, what do you think the patient is?
The patient is in shock, sir.
Yeah, because there is fever, chills, right? And also the vitals or the blood pressure is low. The fever is 102. Then the pulse is also very high, right?
Yeah. Erythematous
Um, yeah,
also, maybe meningococcemia or something.
yeah. There's also a diffuse in erythematous rash, right? So all these clinical signs and symptoms are characteristic of a shock, right? There is an anterior nasal packing in the left nostril, removal of which shows mild mucosal erythema with a purulent discharge, right? Okay, so now, yeah, so we are going to discuss the Staph aureus. They are actually talking about the Staph aureus. So Staph aureus is one of the high yield and it's one of the difficult bacteria. So we'll go through some of the important biochemical properties and also pathogenesis and toxins. Then we are going to come back to the stem, okay? All right, so let me just open my notes. Okay, so the gram-positive cocci, what does, okay. All right, so gram-positive cocci, right? What does cocci mean? Can anyone tell me?
Round circles.
Comma shaped.
Sorry?
It clusters. It clusters.
Clusters.
Yeah, cluster, right? So cocci mean cluster, right? So Staph aureus, the gram-positive cocci, they are. Can anyone tell me the names of bacteria which are gram-positive cocci?
Staph or strep.
Staph, staph aureus, staph, and strep.
Yeah, Staph and Strep. These are the two group of bacteria which are important gram-positive cocci, right? All right. So the staphylococci, um, staph staphylococci are further divided, um, and we have Staph aureus, Staph
Epidermidis.
epidermidis, right? And Staph
Saprophyticus.
saprophyticus, right? So these are the important bacteria which come under the genus Staphylococcus, right? All right. So Staph aureus is one of the high yield and extensive and important bacteria which causes a lot of diseases. Staph aureus it was one of the important culprit in endocarditis, septic arthritis, osteomyelitis. It causes food poisoning. It also causes scarlet skin syndrome. We are going to discuss all of these things, and importantly, it also causes toxic shock syndrome, right? So both this staphylococci and streptococci are gram-positive cocci, right? But they are actually distinguished by two main criteria, right? So, all right. So this Staph aureus, their microscopic characteristics are what will be their shape? So they will come in a grape-like. They
Cluster
will, yeah, they will form a grape-like clusters, right?
form.
And the streptococci, they are going to form chains. Okay. Another important characteristic is the catalase test, right? So the staphylococci, they are actually catalase positive,
Positive.
and the streptococci, they are catalase negative, right? What does the catalase do? Can anyone tell me?
Hydrogen peroxide into water and oxygen.
Yeah, that's right. So what's the importance of this catalase? So catalase positive organisms are those organisms which convert the hydrogen peroxide to water and oxygen, right? What we do in catalase test is once we introduce this catalase, once we introduce this hydrogen peroxide in a colony of uh, bacteria, it forms these bubbles, right? So if it forms these bubbles, it means that it produces oxygen. These oxygen bubbles, right? So they are going to be catalase positive. Catalase enzymes is produced by the the Staphylococci species, but it's actually absent in the Streptococci. So if you introduce hydrogen peroxide into the Streptococci species, it will not produce these bubbles, and they are going to be catalase negative, right? Okay. Um, some of the important biochemical properties of the Staphylococci. Okay, so we are going to discuss Staph aureus now. Some of the important characteristics are, first, they are catalase positive, right? They produces these golden color colonies, these violet color colonies, okay, and that is due to this staphyloxanthine. This chemical, they produce this staphyloxanthine, which uh, impart this violet or golden color to their colonies. The staph epidermidis or staph sepropaticus, um, they will have white colonies, right? All right, so first they are catalase positive. The next important properties are they are coagulase positive.
Mhm.
What does the coagulase enzymes do?
Glutinate blood.
Sorry?
They agglutinate blood.
Yeah, so coagulase is an enzyme that clots the blood, right? So what does it do? It actually activates prothrombin. It converts prothrombin into thrombin, and this thrombin is going to convert fibrinogen to fibrin, right? fibrinogen into fibrin, and it will form a clot. So coagulase is an important property of the Staph aureus, and we also use this property to differentiate it from other bacterias like the other staph species like Staph epidermidis and Staph saprophyticus. Okay. All right. They are also beta hemolytic. So they have an important enzyme called strep beta hemolysin. Okay, and this enzyme, what does this enzyme do? It actually causes hemolysis of the RBCs. So they causes hemolysis of RBCs, break down the hemoglobin, and also it extracts by this hemolysis it extract irons and use it for its energy sources. Okay, so they are also beta hemolytic. Okay, another important property is they actually ferment mannitol. Okay, so they ferment mannitol. All right. So these were some of the important properties. Just to give you a quick revision, Staph aureus, it's a catalase positive organism. It is also coagulase positive. Coagulase, it actually convert prothrombin to thrombin. The thrombin then in turn convert the fibrinogen to fibrin and it clots the blood, right? It's a beta hemolytic organism, and they have beta hemolysin, which actually break down the RBC, extract its iron for its energy source, right? And also ferment mannitol. Okay. All right. Talking about the important virulence factor associated with the Staph aureus species. So the first one is protein A. Can anyone tell me what does the protein A do?
Binds FC region on IgG.
Okay. And what will it do?
It will decrease the complement
Yeah,
activation.
yeah, that's right. So what does protein A do? It actually bind to the Fc portion of the IgG at the complement binding site. Okay. So it blocked that complement binding site, and as a consequence, no C3b is produced, and so no opsonization or um, phagocytosis will occur, right? So protein A is one of the important virulence factor of the Staph aureus species. Did you guys understand till now?
Yes, sir.
Yes, sir.
All right. Uh, Staph aureus also have some teichoic acids, okay, in their cell walls. So what does these lipoteichoic acids do is they actually are important in the induction of the septic shock, right? So they produces these different types of interleukins like IL-1 and tumor necrosis factor, etc. And then leads to the septic shock, right? Also, they have polysaccharide capsule, which is also an important virulence factor. Okay. All right. About the colonization of Staph aureus. So, Can anyone tell me where are these Staph aureus found?
Nares?
In the skin.
Yeah, perfect. So they are found on skin. The main important site is the nares, right? The nose. So they are found on the skin, okay? And about 30% of the people they have staph or they are actually colonized at any time, okay? All right, Steph aureus, what is the other important area which is colonized by one is Neris, right? One other important area where,
Axilla?
yeah, it comes under skin, we can say.
Okay, sorry.
Okay, so another important area where Steph aureus is found is vagina. Okay, so 5% is actually found in vagina. So those people who have like who have nasal packings, right? Who are those women who are using uh, these vaginal tampons? They are going to be predisposed to infection by Staph aureus, right? So this location of um, Staph aureus is actually important. Okay, you are going to be tested on these things. Additional sources of Staph aureus are actually fomites, such as towels, right? And also wounds. They are important source of Staph aureus. All right, important group of individuals which are predisposed to infection by Staph aureus. They are
IV drug user.
yeah, they are IV drug users, those who have reduced immunity, uh, person who are diabetic, and those who have chronic granulomatous disease. They are actually predisposed to infection by um, Staph aureus, right? All right. So now we have some other things to cover like pathogenesis and toxin, etc. But first we will cover the important biochemical properties which we are going to which we are going to use to distinguish them from um, other bacteria. Okay, so let me draw. Okay, so all the gram-positive cocci, they are going to be divided into two groups. Okay, so they are catalase positive, and then we have catalase negative, right? So catalase positive are which organism?
Staphylococcus aureus.
Staph aureus.
Yeah, perfect. Staph, like the staph species. So all the three species, Aureus, Epidermidis, or Cephalopaticus, all three are staph species, right? Catalase negative. Which organisms are catalase negative?
Streptococcus.
Streptococcus pneumonia.
Perfect. Streptococcus species, genus, right? Now, streptococci, they're actually divided based on the hemolysis pattern. They're actually divided into three groups, okay? So one is alpha hemolytic, one is beta hemolytic, and another is gamma hemolytic. What does beta hemolytic mean? Can anyone tell me?
Complete him.
Bacitration sensitive.
No.
Beta
Partial
hemolysis.
Complete hemolysis.
Partial hemolysis or
Alpha,
complete
Complete
hemolysis.
hemolysis.
Complete
alpha,
hemolysis.
Yeah,
yeah,
complete
beta is
hemolysis.
complete, alpha is
Yeah,
partial.
yeah.
Beta hemolysis means complete
Hemolysis.
hemolysis, right?
Yeah.
All right. So the alpha hemolytic, what does the alpha hemolytic mean?
Partial. Yeah.
Partial, right? So those organisms who are beta hemolytic, they are going to completely hemolyze all the RBCs, okay? Alpha hemolytic, they are actually partial hemolysis. So you will have red colonies over here, and over here you will have green colonies, right? So you'll have partial hemolysis, and that is because the hemoglobin is not broken down completely, and some of it is actually oxidized into biliverdin, which import the colonies a green color. Okay, so we have alpha hemolytic organisms, right? So what are the beta hemolytic organism? Too important.
Streptococcus pyogenes.
Yeah, the group A streptococcus or the gas. Okay, or we also call it the strep pyogenes, right? And which other is beta hemolytic? Streptococci.
GBS.
Yeah.
Agalactic.
Yeah, GBS or group B are agalacti, right? So these are our beta hemolytic. What are the alpha hemolytic bacterias?
Very dense streptococci.
Yeah, we have strep pneumonia and we have the viridins, right? And what does the gamma hemolysis mean?
No hemolysis.
No hemolysis. Two important group of organisms we have are enterococci. So we are going to cover all of these today. Okay. This is just to give you a basic organization of the whole gram-positive cocci. Okay, so that you can be able to differentiate between the organism based on the different tests that we run, right? So we have the enterococci, and then we have the streptococcus calyptolyticus, which is not very high yield. Okay. All right. So we already know that we can differentiate between the Staph aureus and the streptococci, the staphylococci and the streptococci by running this one test, catalase part. All of them are gram-positive cocci, so obviously you cannot differentiate based on the gram-positive test. So we'll run the catalase test, right? Once we run the catalase test, okay, if we have catalase negative organism, then we are going to differentiate further, right? So the alpha hemolytic bacteria, uh, we have two species, right? The strep pneumonia and strep viridans, right? So contrasting these two, who is going to tell me the important differentiating points between the two?
Capsulated.
Yeah, capsulated. Strep pneumonia is capsulated and viridans is non-capsulated, right? Another important characteristic is,
Bile, soluble.
yeah, the strep viridans, they are bile. The strep viridans is bile insoluble.
Optochin resistant.
Sensitive. Optogen sensitive.
Yeah, and strep pneumonia is approaching sensitive, right? Veridin is resistant.
Resistance.
Okay. All right. What about the group A streptococcus and group B?
Group A is bacitracin sensitive.
Yeah, perfect. Bacitracin sensitive. And group B is
Resistant.
Resistance.
resistant, right?
And group A is PYR positive.
Yeah, it's PYR positive, and the other one is PRY
Negative.
negative, right?
Yes.
All right. About the enterococci, so important to know is we have two species, right? What are the two species?
Enterococcus faecalis and faecium.
Yeah, we have E. faecalis and E. faecium, right?
Yeah.
Okay, so the enterococci, they actually grow in, they are bile resistant, yes. And also they grow in a hypertonic solution of 6.5% NaCl, okay? And they are also PYR positive. You are not going to be tested on this PYR positive or negative, okay? Important to know is this 6.5% NaCl, they grow in 6.5% NaCl and they are bile resistant, right? The strep galactolyticus, they are bile sensitive. No, they are also resistant, right? And they don't grow in a 6.5% NaCl solution. Okay. All right. So did you guys understand all this?
Mhm. Mhm.
All right. So if I tell you there is a streptococci which is beta hemolytic, so which one that would be?
Group A
Strep.
Yeah,
Streptococcus
group
gas.
A and group B.
Okay, and the bacteria is also bacitracin resistant, so that is going to be.
Group A. So,
Group
sorry,
B.
group B, group B.
Streptococcus agalactiae. Group B.
Okay,
Group
so
B is resistant.
there is another bacteria which is not beta hemolytic, okay, and it is bile insoluble and also approaching resistant. So which one that is going to be?
Viridin. Viridin.
Yeah, that's going to be
Viridins.
very right. There's bacteria which grow in 6.5% ACL.
Enterococcal.
Enterococci.
Okay, perfect, right? All right. So these were the important tests that we run for the um, gram-positive cocci. Okay. All right. Now coming back to the discussion about the Staph aureus. So talking about the important toxins. So who's going to tell me the important toxins produced by the Staph aureus species?
Protein A.
Yeah, that is a virulence factor.
No, it is
Um,
exotoxin.
yeah, the first one is
Toxic.
Exotoxin.
yeah, exotoxin, or like most of them are actually exotoxin, right? But the important ones are the first one is enterotoxin. What does the enterotoxins do? It causes
Food
Food
poisoning.
poisoning.
Gastroenteritis.
Yeah,
Food
it
poisoning.
causes food poisoning or poisoning, right? So this enterotoxin, it's actually a super antigen. What does mean by super antigen?
It directly activates T cells.
Okay.
Activates lots of cytotoxin, I think, and T cells, like
Yeah.
yeah, increase this activity. I don't know what's called.
Okay. All right. So super antigens, they are actually those antigens which directly bind to the T cells receptors, and they produce a lot of cytokines and interleukins, and produce a disseminated reaction, right? So enterotoxin is one of the super antigen. Okay, what happens in the normal and like once an antigen enters in the body, normally what happens?
Normally, MHC is activated like by the antigen presenting cells.
Yeah, once like the antigen gets into the cell, we have lysosomes over there, which degrades this antigen. Then there comes the MHC molecule, either MHC1 or MHC2, depending on the if the antigen is cytosolic, it's inside the lysosome. So if it's cytosolic, so MHC1 is going to present, right? But if it's inside the lysosome or phagosome, so MHC2 is going to activate, it is going to take the fragment, and they're going to present it to the T cells, right? But what happens in super antigens? These super antigens, they are going to they don't go through the normal antigen processing. They actually bind directly to the T cell receptors. Okay, so if you, over here we have a T cell receptor, and over here we have this receptor, right? So they are going to bind to the variable chain on the T cell receptor. Okay, and this subsequently causes a non-specific stimulation. So around 20% of the T cells are going to be activated, and they produce a massive release of a lot of inflammatory cytokines like IL-1, IL-2, TNF alpha and beta. Okay, and these cytokines, what they're going to do, they'll mediate major manifestation of these like they'll cause capillary leakage, causes fever, and all those shock like symptoms, right? So enterotoxin is one of the super antigen, right? And so did you guys understand the mechanism, the super antigen work?
Yes. Yes.
Okay, perfect. So another important toxin uh, is toxic shock syndrome toxin, TSST, right? So this, what does the toxic shock syndrome toxin do?
This is also a super antigen.
Yeah, it's also a super antigen. Okay, it causes toxic shock in people who uses important two important
Tampons,
groups. Yeah,
tampons,
tampons and
nasal packing.
nasal packing, right? So these two important groups that are going to cause toxic shock syndrome toxin, right? Since if these tampons are nasal packings, or for the longer time, so they will grow a massive amount of colonies over there, and they'll produce these TSST toxins. Okay, so the patient is going to present with fever, shock-like symptoms, all the shock-like symptoms, okay? And that is due to the massive release of these interleukins. Okay, another important toxin.
Exfoliative toxin.
Yeah, exfoliative. And what does the exfoliative toxin do?
It causes scarlet skin
Scalded
syndrome.
skin syndrome.
Yeah, it causes this stiff aureus scarlet skin syndrome, right? So these exfoliative toxins, they act as a protease, okay? And they cleaves these important proteins called desmoglein, okay, in the desmosome, and this leads to the separation of epidermis from the skin layer, okay. All right, there is another important toxin. It's called um, leukocidine. What does the leukocidines do?
Cause leukocyte destruction.
Yeah, they causes they kill, they actually kill the leukocytes. So the two important of these are alpha toxin, and there's also another one called PV leukocidine. Okay, Fenton, something like that. Leukocidine. So the alpha toxins, they actually produces holes in the cell membrane, and it causes the loss of a lot of molecules from the cells. Okay, alpha toxins. I think we studied in some other bacteria. I guess this was E. coli, something like that. Is produced by E. coli as well. Okay. The PV leukocidine, it's a four-palming toxin, and it kills um, the white blood cells by damaging the cell membrane, okay? And it creates these pores, and through which the cell contents leaks out, okay? And this PV leukocidine is actually associated with a condition called, who's going to tell me the condition? It's called
Which one?
necrotizing pneumonia, okay? So it causes this necrotizing pneumonia, okay? And this leukocidine, PV leukocidine, also important virulence factor of the MRSA, community-acquired MRSA, also causes soft tissue infections, okay? So this was a little discussion about the different toxins produced um, by the Staph aureus species. Okay, so the first one was enterotoxin. It causes food poisoning. It acts as a super antigen, activating a massive amount of interleukin 1, 2, and tumor necrosis factor alpha and beta. Okay, it binds to the variable region of the T cell receptors, um, and then produce and then activate around 20% of non-specific T cells. Okay, the TSS-T toxins, it causes shock. The two important group of individuals predisposed to TSS-T are tampons using women and nasal packing. Okay, exfoliative toxin, it causes scarlet skin syndrome, and that is due to this protease function, which cleaves the desmoglein, right? Then we have the leukocidine, two important one are alpha toxins, okay, and the PV leukocidine. Important one is the PV leukocidine, which produces this necrotizing pneumonia, okay?
Yes.
Yes.
So did you guys understand till now?
Yes.
Yes.
Yes, doctor.
Okay, perfect. So about the different diseases caused by Staph aureus. Alright. So Staph aureus um, is associated with pneumonia. So it causes pneumonia. So the patient will have this patchy infiltrate on X-ray. Okay, and it can also be it is a superimposed infection. It occurs after a viral infections like Haemophilus influenza, etc. Okay.
Okay.
All right. Staph aureus can also causes septic arthritis. Okay. So it can cause septic arthritis, and this can originate from any localized lesions or any wounds. Okay, or can also occur in intravenous drug users. Okay. Another important condition in Staph aureus is endocarditis. Okay. Um, Endocarditis can occur in any normal or prosthetic heart wall. Okay, and which sided endocarditis is common, especially in intravenous drug users?
Tricuspid wall, right side heart.
Yeah, tricuspid
Tricuspid.
while endocarditis. Okay.
Mm.
Mhm.
Um, Staph aureus can cause osteomyelitis as well. Right.
Yeah.
Okay. So these were the important infection caused by um, Staph aureus. All right. What are the important toxin-mediated diseases? Mm-hmm.
Gastroenteritis, scarlet skin syndrome.
Gastroenteritis. Okay. And
Toxic shock syndrome.
Toxic shock syndrome. Yeah.
yeah, so in gastroenteritis or food poisoning, it is due to the ingestion of these enterotoxins, and it has a short incubation period, and the patient is going to present with prominent vomiting. Okay. There will be less diarrhea and more vomiting. Another condition is toxic shock syndrome. We already discussed, right? And it is characterized by fever, hypotension, and these diffuse macular sunburn-like rash, right? So you will see a sunburn-like rash. And the third important condition is scarlet skin syndrome. Okay, you'll have these bully and erythematous macular rash. Okay, so this is all about the Staph aureus. Okay, what is the treatment of Staph aureus?
Penicillin. Antibiotic.
Sorry.
Penicillin.
Okay, which penicillin?
Um, Oxacillin.
Mafcillin.
Nafcillin.
Naphthalene.
Yeah, so far, like there are two types of species. One is MSSA and there is MRSA, right?
Yeah.
So the methicillin sensitive Staph aureus or napsilin, we are going to give methicillin or napsilin, right? In
Yeah.
MRSA, which antibiotics we are going to give?
Vancomycin.
Yeah, we will
Vancomycin.
give vancomycin.
Linezolid.
All right, so this was all about the Staph aureus. Now let's come back to the question. Okay. Do you have any questions till now?
No.
All right.
No.
The patient actually presented with a toxic shock, like syndrome. Okay, and what we noticed is there were in physical examination, there was a diffuse erythematous rash, right? Important clues were these anterior nasal packing in the left nostril, okay? In all the other cardiopulmonary abdominal examination were normal, okay? So the option A is activation of toll-like receptor by bacterial component. Option B is binding of T cell receptor by bacterial secretory products. C is bridging of cell-bound IgE by multivalent antigens, phagocytosis of bacteria in the blood by neutrophil, and presentation of processed antigen by dendritic cell. So what do you think?
B.
So B,
B.
binding of T cell receptors by bacterial secretory body.
Yeah, why?
Antigen.
Super antigen.
Because
The super
TSST
antigen
is
binds
super
directly.
antigen. TSST super antigen.
Yeah, it's a super antigen. It's going to bind directly to the T cell receptors, okay?
Yeah.
Activation of toll-like receptor by bacterial components, which, what do you mean by this? So the toll-like receptor, they're actually activated by these endotoxin, which are produced by gram-negative bacteria, okay, and also causes similar signs and symptoms like a rapid onset fever and hypertension, okay.
Okay.
Uh, all right, bridging of cell-bound IgE by multivalent antigens. Which condition is this?
Anaphylaxis.
Yeah,
Anaphylaxis.
that is anaphylactic shock, right? Where we have
Yeah.
IgE, they bound to basophil or mast cells, okay? And it releases a massive amounts of inflammatory mediators, and the patient also present with hypotension, um,
Yes,
then
excessive vasodilation.
yeah, shortness of breath, bronchospasm, and it is most commonly caused by food or insect bites or medication, etc. Okay.
Yes.
Presentation of processed antigen by dendritic cells.
Antigen presenting cells.
Yeah, this is like by antigen presenting cells, which um, does not happen in toxic shock like syndrome, right?
Yes.
So the correct option is B. Okay.
Yeah.
So this is a diagram. You can see in normal antigen processing, we have these exogenous pathogen. If it's um, not a cytosol, so it's going to be processed by these phagosome. MHC2 are going to present this to the T cell receptor. But in super antigen, they are going to bind directly to the variable beta chain on the T cell receptor. Okay.
Yes.
All right. The next question. Who is going to read this one for us?
Activation
Activation of which of... Okay, go ahead. It's okay.
Activation of which of the following cells is most likely primarily responsible for this patient condition? A 23-year-old woman is brought to the emergency department due to one day of fever, vomiting, diarrhea, and muscle pains. These symptoms develop rapidly over the course of the day. The patient is confused and unable to answer questions. She has no known medical problems and takes no medications. She lives with her boyfriend. The patient temperature is 39.1, blood pressure is 88/50, and pulse is 120. Respirations are 20. A diffuse erythematous macular rash resembling a sunburn is noted on the dermatologic examination. Pelvic examination reveals a tampon in the vagina. Laboratory results are as follows: leukocyte 8,000, creatinine 1.4, aspartate 62, and alanine amino transferase 49. Normal, both of them. Pregnancy test is negative. Activation of which of the following cells is most likely primarily responsible for this patient condition?
All right. So the patient is presenting with a fever of 102, blood pressure is 88 by 50, and pulse is 120. So the presentation is most likely
Shock.
Shock. Shock.
Shock. Yeah.
it's a shock, right? And
Yeah.
another important clue is there is a diffuse erythematous macular rash resembling a sunburn that I told you about, right?
Corridor skin syndrome.
Yes.
Yeah, and also there is a multi-organ failure. Like you can see, creatine is elevated,
It's
and then
elevated.
yeah, SGPT and SGOT is also elevated. Okay. All right. Okay. So which one do you think is the correct option?
Option B.
Option
B.
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 Yeah.
B.
Macrophages. Yeah.
Macrophages
Macrophages?
and T
Macrophages and T
lymphocyte.
lymphocytes.
Lymphocyte.
Yeah,
Yes.
perfect. Okay. Yeah, we discussed this that the um, superantigens they are going to activate the T cell T lymphocyte. Um, okay, non-specifically. Okay, basophils, as you guys know, they are not associated with toxic shock. They're more important in um, some allergic infection or some myeloproliferative disorders. And Marcel and Xenophil, they're important in allergic conditions like anaphylactic shock, etc. Neutropenia and B lymphocyte. Um, more,
Phagocytosis.
yeah, phagocytosis, right? Platelets and mast cell, same, right? So the important, like, the most likely option is macrophages and T lymphocytes, right?
Yeah.
This is the same diagram, okay?
Mm.
And the next question, who is going to read this one for us?
This patient's medical history is most likely to include which of the following procedures within the past month? A 67-year-old man comes to the emergency department with low-grade fever and fatigue. He has no history of heart disease. His temperature is 38.4, blood pressure is 117 by 76, pulse is 82, and respirations are 14. On examination, there is a diastolic murmur at the left sternal border. He has non-tender erythematous macules on his hands and feet. Blood culture shows gram-positive cocci that are catalase negative and able to grow in hypertonic saline and bile. This patient's medical history is most likely to include which of the following procedures within the past month?
All right. So
Uh, gram negative.
Dental extraction.
yeah.
Dental
So
Dental
extraction.
extracts.
the patient is presenting with low-grade fever and
Cystoscope.
fatigue. Okay.
Yeah.
And important clues are there is a diastolic murmur at the left sternal border, right?
Mm.
Also, there are some erythematous cues on his feet, hands and feet, right?
Mm.
Okay. Blood cultures shows gram-positive cocci that are catalase negative. So, what does this mean?
Viridans.
Strep.
Endocarditis.
Sorry.
Gamma.
Staph epidermidis.
Streptococcus.
Negative, non-stop.
Yeah, they are catalase
Enterococci.
negative. Yeah, they are catalase negative. So it means that this is one of the streptococci species,
Strips.
right?
Yeah.
Then
Yes, sir.
they gave us, let's go step by step, right? So they are resistant to bile. So which important bacteria are bile resistant?
Viridans.
Enterococcus.
Viridans and Enterococci and
Mm.
what else?
Viridin and non-enterococcus, right? Because it's resistant.
Yeah, it's resistant. And also the bacteria grow in a 6.5% hypertonic solution, right?
Enterococci.
Enterococci.
So it's not veridin, right? It's
Mm.
enterococci.
Enterococci, yes.
Okay. So based on this, you can actually uh, correct the question. All right.
GIG. Cystoscope.
Sorry.
I thought you were asking for the option answer.
Yeah.
A.
So
A, it is A,
Cystoscopy,
cystoscopy.
any GI procedures.
After
yeah,
GI procedure.
yeah, that's right. So then enterococci, I told you there are two important enterococci, right? One is E. faecalis and another is E. faecium. Okay. E. faecalis, it's more abundant, it's more common, right? 90% is E. faecalis, but E. faecium is more dangerous. Okay. Important properties are they grow in 6.5% hypertonic solution and they are bar resistant. Okay. Important diseases caused by actually um, uh, denoted by this mnemonic. I love. Sorry, it's do you or it's we can write it trees, right? So we have
Yeah.
this mnemonic for the enterococci. Okay, so U stand for UTIs. Okay, heart stand for endocarditis, and the tree is for biliary tree infections. These are important group of diseases caused um, by enterococci. Okay. The important group of individuals predisposed to infection by enterococci are since where are enterococci most commonly found?
Intestine.
Yeah, in colon. Okay.
Colon. Yes.
So any procedure that involve colon or it's going to predispose to infection by enterococci. Okay. So it includes colonoscopy. Okay. Cystoscopy, and also other obstetric procedures. Okay, they're going to predispose the individual to infection by enterococci. Now, what's the treatment of enterococci?
Clindamycin or something.
A tiger. It was like
Yeah,
take some.
if the patient is not if the strain is not resistant to vancomycin, so we give vancomycin. There are some vancomycin, a lot of actually vancomycin resistant enterococci. We call it Versa.
VRS.
Yeah, Versa, right? So we give linezolid and tetracycline. Okay.
Tetracycline. Yeah.
Tetracycline.
So these two are important drugs we give in. Okay. So the correct option now is
A.
A, cystoscopy.
cystoscopy, right? Dental extraction is for veridents,
Veridance, yeah.
right? Nasal
Staff.
polypectomy,
Staff organ.
Yeah.
yeah, more like this species that colonizes the nasal mucosa. They are like Staph aureus and other bacteria like um, Haemophilus species, right? So these are going to be nasal polyp. All right, sinus drainage. They will be important in strep pneumonia, Haemophilus influenza, right? Correct option is cystoscopy. Okay. All right. Next question. Who's going to read this one? I think this one is not actually related to today's discussion, um, but we still would like to go through this. So anyone can read?
Which of the following factors is most likely responsible for the no urine analysis findings? A 3-year-old girl is brought to the emergency department due to 2 days of worsening dysuria and urinary frequency. She's fully toilet trained, and the parents say that she cries every time she urinates. The patient has had no fever, vomiting, or diarrhea. A small amount of urine is obtained via clean catch collection. Because of the limited volume, only urine analysis is performed. It shows positive leukocytes, esterase, and negative nitrates. The patient is prescribed an oral antibiotic with the first dose given prior to discharge. The following morning, she is taken immediately to the clinic for a follow-up appointment. Another sample is obtained, and urine analysis is now positive for both leukocyte esterase and nitrates. Which of the following factors is most likely responsible for the new urine analysis finding?
Okay. So what do you think is the correct option?
C.
Increased time that bacteria have been in the bladder. Yeah, you are right. So this patient, she has some UTIs, right? Small amount of urine is obtained by clean collection during the daytime. Because of the limited volume, only urinalysis is performed, right? And it shows positive leukocyte stress and negative nitrites. Okay, so in urine, there is a test called urine dipstick, right? And we look for three things in that test. We look for leukocyte stress. What does the leukocyte stress shows us? It's a marker of white blood cells. Okay, so leukocyte esterase, it's an enzyme. It's released by neutrophil and macrophages. So it's going to tell us about the white blood cell. Okay, so in the first test, the patient had leukocyte esterase positive. Okay, it's somewhat a logical question. Okay, then another important thing we look for in dipstick is nitrites. So nitrites, there are some nitrate reductase producing bacteria like E. coli, Klebsiella, and Proteus. These bacteria, they actually produces this nitrate reductase, which convert nitrate to nitrite, right? So this patient, she had like very less amount of urine tested, right? But on the next day, when like the whole night passed, they took another sample, and these nitrate producing bacteria, nitrate reductase producing bacteria, E. coli, etc. They actually converted the nitrates to nitrites. Okay, so it kind of takes some time to convert the nitrate to nitrites. Okay, so that's why in the first case, it was nitrite negative. Okay, so did you guys understand this question?
Yes.
Yeah.
Yes.
So it's about E. coli. We are going to discuss this in our upcoming discussions. Okay. All right. Next question. Who's going to read this one?
Sir, I can. Which of the following is the most important virulence mechanism by which this bacterium causes disease? A 1 year old boy is brought to the emergency department by his mother because of high fever, irritability, and photophobia. He recently underwent ventriculoperitoneal shunt placement for congenital hydrocephalus. On physical examination, his temperature is 38.3 Celsius and passive flexion of the neck results in spontaneous flexion of the hips and knees. Blood cultures show coagulase negative staphylococcus. Which of the following is the most important virulence mechanism by which this bacterium causes disease?
Uh-huh. Okay, so this patient is presenting with signs and symptoms of fever, irritability, and photophobia, and also uh, there is a passive flexion of the neck, which results in spontaneous flexion of the hips and knees. Which sign is this?
Positive Brzezinski.
Sorry?
Positive
False
Brzezinski
is
sign.
Rosinski.
Yeah. So this patient had a ventriculoperitoneal shunt placed for the congenital hydrocephalus, right?
Yes.
Blood cultures showing coagulase negative Staph aureus. So it's not a Staph aureus. Which of the following is the most important virulence mechanism by which this bacterium causes disease? Okay. So there are two other important staphylococcus. Okay. Which one they are? Staph epidermidis
Epidermidis and
and Staph
Saprophyticus.
Staphylococcus.
Staphylopaticus. Okay, about the steps, epidermidis and steps, saprophyticus, both of them are catalase positive. And which another important biochemical properties is common between the two?
Coagulase
Less negative.
Yeah, they are coagulase negative, but which property is common, like shared?
Gamma hemol.
Beta hemolytic.
Gamma hemol.
Yeah, they are. Obviously, they are beta hemolytic.
Beta hemol.
Mm-hmm. They are also
And I
urease.
think Novo biopsy
Yeah, they are also
Urea is
is
positive.
positive,
yeah,
one is
they
Urea is
are
negative.
positive.
urease. They are urease positive.
Okay.
Okay, they are coagulase negative. Okay. So the staph epidermidis, they are found in which areas of the body? They are found mostly on the skin.
Skin.
Okay, and they infects the um
Insulin catheter and this.
yeah, they infect the indwelling catheters. They also infect the orthopedic
Prosthetic
joints.
devices.
joints.
Okay, and they also infect these heart implants and causes endocarditis and artificial implanted heart valves, right? So they actually seek these metallic surfaces, okay, and they actually produce this these biofilm, which are actually polysaccharides, and they use these biofilms to stick to the surface of the of these surfaces. Okay, so this biofilm formation is actually important um, in their pathogenesis. Okay,
Mhm.
so these are actually foreign bodies, right? Like these indwelling catheter or these heart implants or orthopedic joints. They are foreign bodies. So, uh, sorry. Okay. So once these things are actually introduced into the body, they are coated with the host protein like fibronectin and fibrinogen. Okay. And then these protein is serve as as a binding site for the staph epidermidis. So this they produces this biofilm, and they use it to stick to these surfaces. All right. So the staph epidermidis, how we are going to differentiate between the two? So the staph epidermidis, it's no biocene, sensitive or resistant.
Sensitive.
Yeah,
Sensitive.
it's sensitive, right? And the step Sapropaticus, it's resistant, right? And step, what does this step Sapropaticus causes?
UTI.
UTI.
It causes UTIs
UTI.
and sexually active females. Okay.
Cystitis.
All right. So what is the correct option over here?
E.
E.
Yeah, the
Okay.
biofilm.
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 Yeah, synthesis of an extracellular
Polysaccharide.
polysaccharide matrix, right?
Yeah.
Intracellular existence, that's
Yeah.
not correct, right?
Yeah.
Um, there are some bacteria which are intracellular. There are some obligate and there are facultative. Example of obligate are chlamydia and rickettsiae,
Mm.
and there are facultative like Listeria, Legionella, etc.
Yeah.
Outer polysaccharides capsule. Um, mm, uh,
Gram-negative bacteria.
yeah.
Strep.
Presence of protein A on the cell wall. It's Staph yes, right?
Stuff.
Yeah,
Re-
stuff.
We just did it.
Release
Yeah.
of exotoxin. It's also not correct, right?
Yeah.
So, sir,
Uh,
which organism is this?
It's Staph epidermidis, right?
Staph epidermidis. Okay, thank you.
Because the culture grows coagulase negative Staphylococcus. So we have two organisms, right? We have epidermidis saprophyticus, right?
Yeah.
But the patient also underwent a ventriculoperitoneal shunt. And Staphylococcus love to stick to these foreign bodies. So it's automatically staph epidermidis. All
Okay.
right.
Yeah.
Next question.
Which of the following best explains this patient's current condition? A 10-month-old boy is brought to the emergency department due to 2 days of fever, irritability, and vomiting. The patient has had no prior significant medical conditions and has received all recommended vaccinations, including protein conjugated 13-valent pneumococcal capsular polysaccharide vaccine at age 2, 4, and 6 months. On physical examination, the patient is febrile and lethargic with a bulging anterior fontanelle. Lumbar puncture yields turbid fluid with an abundance of neutrophils. Gram stain of cerebrospinal fluid reveals lancet-shaped gram-positive diplococci. Which of the following best explains this patient's current condition?
Mhm. So what do you think this patient is presenting with?
Pneumonia.
Mm-hmm.
Streptococcus.
Meningitis.
Meningitis.
Streptococcus.
Meningitis.
Meningitis.
Yeah, the
Meningitis.
Meningitis.
Yeah,
Meningitis.
yeah, the patient has meningitis. There is fever, irritability, and vomiting, right?
Lumbar puncture.
Also, yeah, the patient has got all the recommended vaccination, a 13-valent pneumococcal polysaccharide vaccine. Um, Lumbar puncture shows abundance of neutrophils, which is a big deal. Meningitis, right? Gram scan of cerebrospinal fluid reveals lancet-shaped gram-positive diplococci. Okay, so what do you think this bacteria is?
Strep pneumo.
Strep pneumonia.
Strep pneumo is lancet
Strep
Yeah.
shape.
pneumonia.
Yeah, we have strep pneumonia over here, right? Okay. So we discussed some important properties of the strep pneumonia, right? So who's going to tell me the important biochemical characteristic of strep pneumonia?
Catalase negative.
Yes, catalase negative.
Alpha hemolytic.
It's an alpha hemolytic. Okay.
Optochin sensitive.
Oxygen sensitive.
It's an approaching sensitive.
Bile
Okay.
soluble.
Bile soluble.
Yeah,
Mm.
bile soluble. Okay. So also they are lancet shaped diplococci. Okay. So, all right. You can just give me a minute, okay? Okay. Also they have this IgA protease activity, okay? And they cleave this IgA and it helps in the survival of these organisms in the upper respiratory tract, okay? So they have these IgA proteases, which actually enhances this organism ability to colonize the upper respiratory mucosa, okay? So once the strep pneumonia gets into the upper respiratory tract, the IgA is going to protect it. Then when it gets into it, when it reach in the alveoli, so this patient is going to present with a rust colored sputum, okay, and there will be a lobar pneumonia, okay. So when this organisms reaches the alveoli, it causes the outpouring of the fluid. It causes the lysis of WBCs and RBCs. Okay, it also, and this is why it causes this rust color sputum. Okay, and causes this lobar consolidation due to the outpouring of this fluid from the alveoli. Okay, important group of diseases caused by strep pneumonia are denoted by mnemonic MOBS. What does the M stands for?
Meningitis.
Meningitis.
Okay, O stand for,
Otitis media.
Otitis media.
P stands for
Pneumonia.
Parotype. Pneumonia.
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 pneumonia, and S stands for
Sinusitis.
sinusitis, right?
Yeah.
Okay. Also, patient with splenectomy or sickle cell diseases, they're going to be predisposed to infection by strep pneumonia. Okay. Okay. The treatment for strep pneumonia is
Antibiotics.
antibiotics. Which
Okay.
one?
Ceftriaxone.
So,
Toxiclef.
We
well,
give
ceftriax.
azithromycin and ceftriaxone. Okay, so these are two important antibiotics. So there are two types of vaccines available. One is for children and one is for adult. Okay, so in
Yeah.
case of children, which type of vaccine we give?
This
The
pneumococcal
PCR.
conjugate, the
Pneumococcal conjugate.
conjugate.
Yeah, we give the conjugated vaccine, which is 7-valent. Okay, it's conjugated to protein. It causes a T cell dependent reaction. Okay, in adult,
We
which
give
vaccine we give?
PPSV.
Pneumococcal capsule.
We give,
PPSV.
yeah, we give 23-valent vaccine, which creates a T cell independent immune response. Okay. Also, these strep pneumonia, they are capsulated. Okay, so it's also an important property. Contrasting this with the strep viridans, okay, they're also catalase negative, alpha hemolytic, but they are up to chin um, resistant, right? And thereby insoluble.
Biochemistry.
Insoluble.
Okay, and important disease caused by strep viridans.
Dental
Endocarditis.
Infective
caries.
endocarditis.
Yeah, dental caries and precision involving these dental procedure, it leads to big endocarditis. Okay, so it causes endocarditis. They which really adheres to the fibrin platelet aggregates and damage heart valves. Okay.
Okay.
All right. So, which one is correct option now? Antigenic variation of bacterial cell wall, infection
C.
from
C.
capsule lacking bacteria, infection from non-vaccine serotypes. Okay.
Yes.
Yeah.
Yeah. So there are actually hundreds of serotypes. So if there is a definite serotype which is not included in the vaccine, we give. So they are not going to be protective against that serotype, right?
Yes.
Okay, so the correct option is infection from non-vaccine serotype. Did you guys understand this question?
Yeah.
Okay, perfect. Now, who's going to read this one?
Can I read?
Yes,
Gram
go ahead.
staining of Gram staining of purulent drainage from this lesion is shown below. A 22-year-old man come to the office due to painful lesion on his upper back. Patient developed a small tender pupille a few days ago that progressively enlarged and become red and painful. He has had three similar lesions on his upper back over the past 6 months, which were treated with incision and drainage of antibiotic. The patient has no other medical issue and takes no medication. He does not use tobacco, alcohol, or illicit drugs. On physical examination, there is 3 centimeter tender pustule with surrounding erythema on his upper back. Gram staining of purulent drainage from the lesion shown below.
Mm, which of the following most likely
Which of the
predispose?
fall, yeah, which of the following most likely predispose this patient to his recurrent infection?
Okay, so what do you guys see in this picture?
There's a grape like the stuff.
Yeah,
Yeah,
staph,
Hi.
I and cotton clusters.
clusters.
Yeah.
yeah, there are grape-like clusters, right? These
Yeah.
small dots that you guys see, right?
Yes.
Okay, so in the stem, you can see the patient has having painful lesions on his upper back. There are small tender papules, which are red and painful, treated with incision and drainage antibiotics. Okay. Um, there is a 3 centimeter tender pustule with surrounding erythema in his right upper background standing up and so the patient has this soft tissue abscess, okay, which is caused by Staph aureus, right? So they are asking about the important, like the correct option. So what do you think is correct?
Colonization in the interior
A.
nares.
That's,
A.
yeah.
Yeah, colonization in
Yeah,
anterior
A.
node.
Stuff.
A.
Stuff of
Colonization.
Yeah.
the Morris.
Okay, next question.
Which of the following symptoms would be most likely to develop as potential complication of this patient's infection? A 40-year-old boy is brought to the office due to skin lesion on his chin for the past 2 days. Temperature 36.1. The patient is well appearing. There are mildly tender perioral papules and pustules, some of which appear to have broken down and are covered with the amber-colored crusting. A wound culture is taken. Gram stain shows a gram-positive cocci in chain. Which of the following symptoms would be most likely to develop as a potential complications of this patient infection?
Okay.
Impetigo.
Yeah, impetigo.
Impet.
Yeah, the patient is having
Staph
impetigo.
aureus.
Strep.
Crusting.
Oh,
Amber
strap.
color crusting.
Strap in chain.
Strep.
Strep.
Yeah, there are
Positive
gram-positive
tension.
cocci in chains, right?
Yeah.
It
In
is in
chains.
chains.
Yeah.
Chains.
Chains.
Yes.
All right. So which of the following symptoms would like most likely to develop is a potential complication of this patient's infection. Okay. So we have not
Facial
dis.
puffiness, yeah, and dark
Yeah.
urine.
Yeah.
So
So
Fecal.
we
it's
have.
Streptococcus pyogenes.
Yeah,
Yeah,
yeah.
Yeah.
most likely.
It's Streptococcus pyogenes. Okay.
Um,
So a little discussion about the
Phenomenal practice.
strep pyogenes. Okay. So strep pyogenes. These organisms, they are actually, they are catalase negative, right? And their important properties is they are beta hemolytic. Which another streptococci is beta hemolytic?
Staph
Ruby.
Aureus, Aureus,
No,
Staphyl-
streptococci.
Ruby.
Sorry.
Mm,
Staph.
Group A, Group
Staphylococcus
A.
Group A and
aureus,
Group B.
Yeah, this is
Streptococcus
group.
A.
Sorry.
galacti.
Yeah, group
Galaxy.
group B
Ruby.
streptococcus, right? Okay. They are also encapsulated, and they have these important chemicals in their cell wall called hyaluronidase. Okay. Okay. Important condition caused by strep pyogenes or impetigo. What else? Strep throat. There will be like wild
Scarlet fever.
exudations.
Scarlet fever.
Scarlet fever.
Yeah, erypsilas.
And the Jones, what is that?
Yeah, it also causes scarlet fever. What do we have in scarlet fever? What can you
Strawberry
please
tongue.
specify?
Strawberry tongue.
We have
we have
Strawberry.
strawberry tongue.
sandpaper,
And
We
scarlet
have
sandpaper
sandpaper,
rash.
Sandpaper rash.
Paper rush.
we have pharyngitis. We have um
Typical lymphadenopathy.
we have this toxic shock like syndrome as well. Okay, and there is a necrotizing fasciitis.
Yeah.
These are the important clinical manifestation caused by the strep pyogenes. Okay. All right. Okay. So who is going to tell me the important toxins produced by strep pyogenes?
Toxic shock like toxin.
Scarlet fever is caused by which toxin?
Toxic shock like toxin causing this and necrotizing.
Erythrogenic
Erythrogenic
exotoxin.
Yeah, erythrogenic, right? Okay. It's also a super antigen. It causes this toxic shock syndrome. Okay, just like that of the Staph aureus.
Hmm.
All right. Another important toxin is strep.
Exotoxin, erythrogenic exotoxin.
Yeah, take exotoxin A, right? When we have streptolysine O, right? It's a hemolysin. It causes beta hemolysis. Okay, and it is important. It is antigenic, and we produces an antibody against the streptolysine O, which is called ASO. We use it to titrate the antibody, and it is one of the important biochemical tests. Okay, but this one is going to take some weeks, so it's not very important test. Okay, then we have another similar toxins called streptolysine, which is the same function. Then we have pyrogenic exotoxin A, which causes the toxic shock syndrome. Okay, and then we have the exotoxin A and B. Okay, so we have the the toxin A and C, it's going to cause the toxic shock-like syndrome, okay? And the exotoxin B, what does it cause? This is high yield, okay? So the exotoxin B, it causes necrotizing fasciitis. What is another name for the necrotizing fasciitis, the bacteria that causes?
Compartment syndrome.
No, it's called flesh eating
Oh, sorry, so that's
bacteria.
that
Okay.
necrotizing fasciitis.
Yeah, it is caused by exotoxin B. Okay.
Yes.
Okay. There are important virulence factor. Um, what does the M protein do?
And protein, like in
Phagocytosis.
Phagocytosis,
it
Phagocytosis. Phagocytosis.
opsonization, decreases opsonization.
No, they inhibit phagocytosis.
Yeah, it's a virulence
Yeah, it's
factor.
various
anti-phagocytic.
factor, yeah.
Yeah, it's a virulence factor, and it is important for the rheumatic fever because, and its function is to interfere with opsonization, and it's an anti-phagocytic. Okay,
Yes.
so M protein actually mimic a similar protein found in the heart, myosin. Okay, so if we produce antibodies against this M protein, so it's going to attack. These myosins in our normal heart. Okay, so
Yeah.
it leads to a rheumatic fever. Okay,
Fever.
so we uses the Jones criteria for the rheumatic fever. Okay,
Mm.
J for giants, O for heart, then nodules, erythema marginatum, and Hans chorea. Okay.
Yeah.
Post another important manifestation caused by strep pneumonia is PSGN, okay, post strep
Mm.
glomerulonephritis. The patient is going to present with puffy cheeks, okay, and cola colored urine. These two are important clinical signs in patient with PSGN, okay.
Okay.
And it can occur after pharyngitis and impetigo. All right. So this was a little discussion about the strep pyogenes. Hope you understood. Okay? So the correct option is facial puffiness and urine. Okay.
Yes.
Doctor.
Because impetigo actually predispose, or we can say will have make patient vulnerable to have PSGN. Okay.
Mhm.
Yes.
Doctor.
Anyone?
Yeah.
Yes.
The toxins you told us exotoxin A, B, and erythrogenic toxin. These are the important ones, right? These three.
Yeah, we have in the exotoxins we have three types, right? We have the exotoxin A, B, and C. So A and C are associated with toxic shock-like syndrome, and the toxic exotoxin B is associated with necrotizing fasciitis. Okay.
Okay.
Yeah,
Okay.
and there was another erythrogenic toxin which causes scarlet fever.
Okay. Thank you.
One more question, can I ask, please?
Yes.
Okay, so the complication, is it only PSGS, like post-streptococcal glomerulonephritis? What about rheumatic fever?
Yeah, rheumatic fever also occurs. I told you about this M
Yeah.
protein, which actually kind of we call that phenomena molecular mimicry, right? So what happens is this M protein is actually an important virulence factor of the strep pyogenes. So it actually mimic the another protein found in our normal heart, the myosin. So once we make antibodies against this M protein, it's going to attack the normal heart as well. Okay, it's gonna cause this this rheumatic fever. Okay, so we will okay, so if there is a patient is present, if there is a pharyngitis, it's going to precipitate the rheumatic fever. Okay.
Yes.
All right. So okay. Next question.
The patient's blood cultures are most likely to grow which of the following organisms? A 23-year-old woman comes to the hospital due to fever, chills, dyspnea, and cough for the past several days. She also has sharp right sided chest pain exacerbated by the breathing. Her temperature is 39, blood pressure is 115 by 70, and pulse is 108. On examination, the patient has several needle track marks on both arms. There is 3 by 6 hollow systolic murmur heard best at the lower sternal border that increases on inspiration. Chest imaging reveals scattered bilateral peripheral lung opacities. HIV testing is negative. The patient's blood culture are most likely to grow which of the following organisms?
Okay. So uh,
Staph aureus?
yeah,
Yes,
IV
you're
drug
Staphylococcus.
user.
you
Yeah,
are
I will
right.
not you. Yeah.
Mm.
You are right. Okay. So we have this patient presenting with fever, chills, and dyspnea. Temperature is 102, blood pressure and pulse. Patient has needle track mass. This is one important clue. The patient is IV drug abuser, right?
Yeah.
There is a 3 by 6 holosystolic murmur heard base at the lower sternal border that increase with
Inspired.
inspiration, right?
Yeah.
Okay. So this patient has most probably has endocarditis. Okay,
Yes.
and also chest imaging reveals scattered bilateral peripheral lung opacity. Why does the patient present with this manifestation?
He has are these pneumonic patches?
Yeah.
Lung opacities.
But why with scarlet with Staph aureus?
Because of this IV drug user, that's the
Mm,
risk factor.
yeah, it is. But what is the mechanism of this disease? Like about the
Tricuspid
You mean the
regurgitation.
post
sorry.
like flu? But it's not. He doesn't have flu. I don't know.
Because there is fever, chills, and cough, so it is like flu-like symptoms. You said after
Yeah.
influenza virus, right?
But there no.
No?
He is presenting with fever, chill, and dyspnea and cough, right? And they
Is
are
it
literally the
Bovard
manifestation.
pneumonia?
No, no, it's not.
No. Okay.
So,
There's
this
a
patient,
murmur too, na? So it can be rheumatic
Tricuspid
fever. Yeah.
regurgitation.
yeah, the patient has right-sided endocarditis, the tricuspid endocarditis, right?
Yeah.
So what happens in patient with IV drug users, this Staph aureus, they go from the they go from the skin and spread heterogeneously into the heart, and most commonly they affect the tricuspid valve, right?
Yeah.
So most commonly they causes the right-sided endocarditis, but in some patient they can also causes left heart endocarditis. Okay, so in right-sided endocarditis, these Staph aureus bacteria they are going to settle on the wall leaflets, okay, and they can actually cause some manifestation. They can actually uh, break or perforate these walls, can rupture the chordae tendineae, okay, and also can send septic emboli to the lung, okay. But this will happen with the right-sided endocarditis due to the flow of blood, like ones like the um, Staph aureus. It's going to be in right-sided endocarditis. It's going to affect the tricuspid valve, right? So in right-sided endocarditis, it's going to send these septic emboli to the lung, okay, and this is going to cause. That's why the patient is presenting with these bilateral peripheral lung opacities. Okay. Also, they can cause left heart endocarditis. That in that condition, they can usually send septic emboli to either the brain or systemic circulation. Okay.
Yeah.
So this patient has this tricuspid regurgitation. Okay. So correct option is Staph aureus. All right. Next question.
May I?
Yes, go ahead.
The organism contributing to the patient current situation is associated with which of the following? A 53-year-old man come to emergency due to 2 week intermittent low-grade fever and fatigue. Temperature is 101, blood pressure 120/80, pulse 92, and respiration 16. On CVS exam, an early diastolic murmur is present and best heard at the left sternal edge. Subungual splinter hemorrhage are seen. Laboratory results show leukocytosis and elevated ESR. Blood cultures are drawn and grow gram-positive cocci that synthesize dextrins from sucrose. The organism contributing to this patient current condition is associated with which of the following conditions?
Mm-hmm.
So
So
he's having infective
Infective
endocarditis.
endocarditis.
Yeah, with splinter hemorrhages and dextrans. Yeah.
yeah, that's right. So the blood cultures are drawn and grows gram-positive cocci that synthesizes dextran from sucrose, right?
Yeah.
Um, which of the following condition? So which one is the correct option?
Dental caries?
Yeah, it's a strep.
Evidence? Yeah.
Yeah, it's strep infection. They actually make these dextran, okay,
Mhm.
and it's associated with dental caries. All right.
Are we going to get the recording of this class, right?
Yeah, I will send you the recording.
Thank you.
We do have some more questions. I think 10 or 12 questions left. We'll go through those quickly, okay? Let's first complete this block and then we'll do the another one after a 5-minute break, okay? So read this question.
In addition to sterile draping during the procedure, which of the following actions would be most likely to prevent intravascular catheter-related infections? A 37-year-old man is brought to the ED following a motor vehicle accident in which he was the unrestrained driver. Paramedics report that his breath smelled of alcohol in the scene. En route to the hospital, the patient receives 2-liter IV normal saline. In the emergency department, his blood pressure is 100/60, pulse is 130, and respirations are 44. He is admitted directly to the ICU where he is intubated and placed on mechanical ventilation. A decision is made to insert a central venous catheter. In addition to sterile draping during the procedure, which of the following actions would be most likely to prevent intravenous catheter related infections?
Mhm.
Alcohol-based hand scrub.
Raise hand scrub.
Yeah,
Correct.
alcohol-based hand scrub prior to beginning the procedure is the correct option, right?
Yeah.
Because infection originating from the patient's skin flora or bacteria is one of the important complication in patient with CVCs, right? So, correct option is alcohol-based hand scrub prior to beginning the procedure. This was sample one. Now, next question.
Which of the following complication is most likely to develop in this patient? A 12-year-old boy is brought to the office with fever, chills, and a rash that appears this morning. 2 days earlier, the child started complaining of sore throat. His temperature is 38.3 Celsius. Examination showed diffuse erythematous rash on his chest and abdomen that blanches with pressure, along with numerous 1 to 2 mm papules. The throat is erythematous with gray-white tonsillar exudate and tongue is bright red. Which of the following complication is most likely to develop in this patient?
Okay, this one is easy. It's going to
Rheumatic fever,
Fever.
right?
Heart. Option
yeah,
E.
Yeah.
Rheumatic fever.
yeah. What does the patient has? Which condition?
That is scarlet fever.
Scarlet
Scarlet
fever.
fever.
Yeah.
Yeah, scarlet
Yeah,
fever,
the
right?
tongue is bright red, strawberry tongue.
Yeah.
Yeah, patient has this strawberry lung, right? And also has pharyngitis, which usually precipitate rheumatic fever, right?
Yeah.
We already discussed this one. All right, next question.
Which of the following pathogens is most likely responsible for this patient's condition? A 36-year-old man is admitted to the hospital with severe left leg pain after suffering a minor laceration to the leg 2 days earlier. Temperature is 39.5 and blood pressure is 85 by 45. On physical examination, the left leg is swollen and firm with erythema of the overlying skin. There is small wound draining blood tinge exudate on the left calf. The patient is taken to the operating room immediately and large area of necrotic tissue is excised. Gram stain of the necrotic tissue shows gram-positive cocci and culture of bacteria performed on a blood plate agar grows small colonies with a wide zone of surrounding hemolysis. Coagulase and catalase tests are negative and P by R test is positive. Which of the following pathogen is most likely responsible for this patient?
Okay. So, what do you guys think?
Biogen.
It's
Streptococcus
Streptococcus pyogenes.
Biogens.
Yeah.
Yes,
E.
Yeah.
what condition the patient is having?
Necrotizing
Necrotizing
fasciitis.
fasciitis.
Necrotizing
Fasciitis.
fasciitis.
Yeah, the patient has necrotizing fasciitis, which is caused by which toxin?
Exotoxin B.
Yeah, exotoxin B, right?
Yeah.
So, did you guys understand this question?
Yeah.
Yes.
Okay, perfect. Okay, last question.
Which of the following is most likely pathogen infecting this patient? A 6-hour-old boy is evaluated in the newborn nursery due to temperature instability, grunting, and lethargy. The patient was born at full term to a 21-year-old woman who came to the emergency department in active labor with ruptured membranes. She had not received adequate prenatal care. On physical examination, the boy is hypothermic, tachycardic and tachypneic, and he has mottled skin. Blood samples are obtained and empiric antibiotic is initiated for the treatment of sepsis. Cultures of blood agar grow bacteria colonies with a narrow zone of clear hemolysis. When these bacteria are grown in the presence of Staph aureus, the zone of hemolysis is enhanced around the staphylococcal colonies. Which of the following is most like pathogen infecting this patient?
So what does this patient has?
GBS group B streptococcus.
No,
Infection.
yeah, like, okay. The patient is presenting, this child is, newborn is presenting with grunting and lethargy, right? Um, he has meningitis, okay? Um, the patient was born at full term to a 21-year-old woman, um, and who had rupture membrane, okay? This is one important clue. When she had not received adequate prenatal care, okay? Was is hypothermic, tachycardia, and tachypneic, and has motile skin. Um, Culture shows a narrow zone of hemolysis, and when these bacteria are in the presence of staph aureus, the zone of hemolysis is enhanced around the staph colony, right? So the group B streptococcus. So important biochemical properties of group B streptococcus. Who is going to tell us?
Alpha hemolysis.
No.
Beta hemolytic.
Beta hemolysis.
Beta
Yeah,
Plus
hemolytic.
yeah, they are beta
Yeah, beta.
hemolytic. Okay. So they have this camp factor. Okay. CAMP, camp factor. And what happens in this camp test is when this GBS colonies are platted along with the staph aureus, it causes an enhanced zone of hemolysis. Okay, so this factor, this CAM factor, when it combines with the beta hemolysin of the um, staph
That's
aureus, it causes an enhanced zone of hemolysis. Right, so this is the CAM positive CAM test. Okay, so it's CAM positive. Also, it's a what important, another important test.
bacitracin resistant.
Yeah, it's a bacitracin resistant. Another important test we do.
PYR negative.
Yeah, there is another important test.
Hepatitis.
Oil cells?
They,
Hepatitis.
yeah, they are heparin positive. Okay. Okay. Um,
What's
but
hepatitis?
they actually hydrolyzes this sodium heparate. Okay, and we call this heparate.
Okay. Mhm.
Okay. Oh yeah. Important clinical manifestation of GBS. They causes meningitis,
Pneumonia,
Meningitis,
meningitis.
sepsis.
pneumonia, sepsis. Okay. All right. So, who? Okay. Which individuals are predisposed to GBS?
Pregnancy.
Pregnant patients. Yeah,
Yeah,
pregnant.
of course. Pregnant patient.
Newborns.
Mm-hmm.
The mother who previously have the GBS now recurrence is more in that patient.
Mm-hmm.
And babies, yeah.
Okay, so first of all pregnant women at 35 to 37 weeks of gestation, they will be screened for these for GBS culture. Okay, so
Yes.
any patient who has not gotten adequate prenatal care, they are actually predisposed, right? So if the culture is positive for GPS, so we give which antibiotic we give?
Penicillin, ampicillin.
Penicillin G, right? Or ampicillin. Okay. Um, so if the test is positive, so we give penicillin G. What if the patient has not gotten adequate, like he has had no culture done? So what we do is um,
We
we
give
And
will,
drop out of
prophylaxis with
prophylaxis
penicillin.
during the
Yeah.
labor.
yeah,
Yeah.
but we don't give these in all patient. Patient with prom, we will give prolonged rupture of membrane is this patient, okay? And those patient who has fever, we will give antibiotic prophylaxis, okay?
Okay.
So this is high yield. At 35 to 70, 37 weeks, we do culture for the GBS. If it's positive, we give penicillin G. If patient has had no culture done, so those patients who have prolonged rupture of membrane or those who have fever at the time of delivery, will give antibiotic prophylaxis, okay? So the correct option is Streptococcus
D. Yeah.
pyogenes. Okay.
Yes.
All right. So we'll take a small break, okay, of 5 minutes, and then we are going to do another block, okay?
Okay.
Sir, how much like long we are going to cover microbiology for, like the schedule is for how many days?
Actually, have not we have actually not made a schedule for micro since it's actually very scattered. But if we do micro, then it's gonna take around 10 days. Since it's very extensive, we have around 300 MCQs.
Okay, and after finishing microbiology, we're gonna start the other system.
So either we can do the hematology along with the micro, like we'll take one hour lecture of micro. We'll slowly do like the micro, like discussing 3 4 bacteria every day.
Okay.
Or we can just do the micro. It's up to you guys. We'll run a poll. I recommend that we do in small part. Like micro is it's very hard to retain. So doing all the things at once, you probably will not get.
Yeah, that's
So
fine. We can do like micro 3 4 bacterias, and along with that, we can go with hematology.
So
yeah.
will you take hematology for us?
No, I think Dr. Ikram will teach you hematology, I guess.
And sir,
Okay.
when this program is like one, what is the expected date of this program to end? Like what is
We
your plan?
have we have hematology left, and I think neuro.
And
So it's not
reproduction.
Reproduction.
in reproduction. Yeah. Also, we'll try to do the general principles, biostats and biochem.
Yeah.
So
Biochem and genetics.
yeah. So
And
around 1 month will be enough.
and sir, are you going to cover immunology and yeah, immunology and biostat too or no?
Yeah, I will call them. We'll teach you immunology as well.
So like according to you or according to the schedule you made, it's like do you think so we will be able to done by the first week of December or no?
Yeah, most probably, if everything goes well, we will be done with everything by first week of December. Okay.
Okay.
Also, for the new students, we actually conduct an NBME series in the end of every program. Okay. A lot of students, they actually don't have an idea um, about when they should schedule their exams, whether they are 100% prepared for their exam or not. So for that purpose, we are actually conducting NBME exams at the end of every program. So Samuel, we will do in this program as well after we are done with almost all of the organ systems. So we'll conduct one NBME exams that's going to tell you where you guys are actually standing and where you should work, which areas you should work on. Okay, because you guys cannot go blindly and sit for your SAP 1 exam. You guys can take SAP 1 once, right? And you want to pass in on your first attempt. So make sure you're not rushing your exam, even if it takes like 2 or 3 or 1 or 2 extra months, give it, but don't rush your exams, okay?
Okay. Thank you, sir.
All right, so we'll take a small break of 5 minutes and then we'll do the other block, okay? Hello. So let's start the other part. Okay. So who is going to read this question?
Which of the following organisms is most likely responsible for this patient's symptoms? A 10-year-old boy is brought to the emergency department after experiencing high fevers and chills. I, Doctor, I can't read. You have something. Yeah.
Mhm.
High fever and chills for the last few days. He also complains of dull pain just above his left knee. He has no history of recent trauma other than minor scrapes to his knees and elbows while playing outside. Physical examination shows point tenderness 3 cm above the kneecap. There is no joint effusion. Radiographs show soft tissue swelling and a periosteal reaction over the lower end of the femur. Which of the following organisms is most likely responsible for this patient's symptoms?
Mhm. So what do you guys think this patient has?
It's osteomyelitis
Yeah, perfect. So the
and
patient,
Staph aureus is the organism causing it.
yeah, the patient has high fever and chills. Okay. He also complains of dull pain. It's about his left knee. No trauma, but there were minor scrapes to his knees and elbows while playing outside. Point tenderness 3 centimeter above the kneecap. Radiographs show tissue swelling with in a periosteal direction over the lower end of the femur, which is characteristic of the osteomyelitis, right? So the following organism is most likely responsible for this patient symptoms, right? So most probably it's Staph aureus, right? Enterococcus faecalis, you guys know, it causes which diseases? Yes.
Um, um, you said, do you love trees? Something like that. For
Yeah.
UTI and endocarditis and biliary tree infections.
Yeah, that's right. Moraxilla catarrhalis. We're going to discuss this next, which is important in otitis media and sinusitis, Staph aureus, in staph epidermidis. You guys know it's important um, in implants and wearing catheter, etc. Okay. Strep epilepticus causes sepsis, meningitis, pneumonia in newborn. Strep pneumonia is important cause of community-acquired pneumonia. MOPS, we denoted by MOPS, right? And Strep
Yeah.
vaginalis. Okay, so correct answer is Staph aureus.
Staph aureus.
Okay. There are some other bacteria as well which causes osteomyelitis. Okay, so Staph aureus causes osteomyelitis of the long bones like femur, etc. Salmonella, it also causes long bones. Then we have Mycobacterium tuberculosis, causes port disease, right? Polymicrobial diabetes mellitus, recombinant patient with impaired mobility. It's also polymicrobial, recent trauma, orthopedic surgery, polymicrobial. Okay. All right. Next question. Who's going to read this one?
This pathogen must likely demonstrate which of the following characteristics. 52-year-old man is hospitalized due to 2 weeks of low-grade fever malaise, anorexia, and fatigue. The patient has history of bicuspid aortic valve and underwent aortic valve replacement a year ago. Physical examination reveals a new regurgitation murmur. Blood culture repeatedly grow gram-positive cocci in clusters, which are identified as Staphylococcus epidermidis. This pathogen most likely demonstrate which of the following characteristics?
So, what do you guys think? Culture grows gram-positive cocci and clusters, right? Which are identified as staph epidermidis. So, what do you think is the correct option?
Negative
E.
coagulase test.
Sorry?
Negative coagulase test.
Yeah, that's
Or
right. Now, tell me, just quickly tell me without thinking for each option. Alpha hemolysis.
alpha hemolysis is
Pneumonia and
viridans.
viridans.
Yes, pneumonia and viridans.
Yeah, pneumonia and variants. Mannitol.
Staph aureus.
Staph aureus.
Negative catalase test.
Streptococcus.
Streptococci. No bison resistant. Quickly.
Novomycin
Saprophyticus.
resistant saprophyticus. Yes.
Saprophyticus.
And yellow pigment production.
Aureus.
Streptococcus aureus.
Staph aureus.
Okay, perfect. All right, next question.
Which of the additional characteristics are these bacteria most likely to demonstrate? 46-year-old man comes to the office due to 3 days, fever, shortness of breath, rheumatic chest pain, and cough with purulent sputum. Patient has no medical conditions and take no medications. He smoked cigarettes with daily for 20 years, temperature is 100. Examination, there are crackles in the base of the left lung. Chest X-ray reveals consolidation in the left lower lobe. Microscopy analysis of sputum sample show gram-positive, lancet-shaped cocci in pairs. What are the following additional characteristics are these bacteria most likely to demonstrate?
Mm-hmm. So,
Lysis in the presence of bile salts.
mm-hmm. So, what condition this patient has?
Global pneumonia.
Okay. And important pathogen.
Streptococcus
Pneumonia.
pneumoniae.
Mm-hmm.
Lancet shape.
So, the correct option is
D.
lysis
think
in the
bile-
presence. Yeah, you are right.
Bile salt sensitive.
Okay. Let's go through the other options. Resistance to aptogene. Mm-hmm.
Viridans.
Okay. Production of the catalase enzyme.
Staph
Staphylo-
aureus. Staph.
yes, Staphylococci. Lysis in the presence of bile salt. Is our correct
Pneumonia.
option. Growth in hypertonic is enterococci. Complete.
Enterococci.
Yeah,
Enterococci.
Beta hemolysis. GAS and GBS. Group A
yeah.
and Group B.
Also Staph aureus, right?
Yes.
And ability to hydrolyze with P by R. And they are
Group A.
Pyogenes.
Streptococci.
streptogenes and enterococci, right?
Enterococci. Yes.
Okay. Next question.
Which of the following bacterial virulence factors most likely contributed to this patient's necrotizing infection? A 36-year-old man is hospitalized due to worsening fever, productive cough, and shortness of breath. He has no prior medical conditions but experienced an influenza like illness during the previous week. Temperature is 38.3, blood pressure is 100 by 50, pulse is 122, and respirations are 26. Pulse oximetry is 86% on room air. On physical examination, the patient is ill appearing and lethargic. There are crackles over the right lower lung. Leukocyte count is 20,000. Chest imaging reveals extensive parenchymal consolidation and cavitation suggestive of abscesses in the right, middle, and lower lobes. The patient is endotracheally intubated for mechanical ventilation due to worsening respiratory failure. Culture of the tracheal aspirate grows gram-positive cocci in clusters. Which of the following bacterial virulence factors most likely contributed to this patient's necrotizing infection?
Mm-hmm. So, um, this patient has necrotizing pneumonia that I discussed with you. So,
Leukocidin, right?
yeah, the correct option is leukocidine. We already talked about this. We have PV leukocidine, which is important to exotoxins, and there are two leukocidines. We have two, like alpha toxin and PV leukocidine. PV leukocidine is important for necrotizing pneumonia, skin and soft tissue infections, and wound, etc. Right? How do they work? They actually, there are two subunits of leukocidins. They actually make a pore in the cell membrane and causes the cellular content to leak out. So, along with destroying the WBCs, they also destroy the human tissues as well, including the lung tissues. Okay, so this is the mechanism of action of leukocidine.
So what's the organism? Sorry.
Staph aureus.
Yes,
Staph.
it's associated with Staph aureus. All right, next question.
No one wants to read?
Which of the
Okay.
following is the most likely cause of this patient's symptoms? 6-month-old boy is brought to the emergency department due to poor feeding, irritability, and rash. He was well appearing until 2 days ago when he developed little interest in drinking and progressive rash. Physical examination reveals diffuse erythema and desquamation that is most prominent at the neck, axillae, and inguinal folds, and the perioral region. The perioral area also has crusting and the lips are dry and cracked, but the mucosal membranes are normal. The epidermis easily comes off with a gentle pressure at the erythematous area. Which of the following is the most likely cause of this patient's symptoms?
Mm-hmm.
Is this scalded skin syndrome?
Yeah, that's right.
Yeah.
It's scarlet skin syndrome, right?
Mm.
The patient has diffuse erythema with discrimination, crusting, lips and crack, right? And also the epidermis easily comes off. So, which toxin is responsible for this scarlet skin syndrome?
Is it D?
Exotoxin means
Toxin.
skin
Exotoxin?
damage.
What is the name?
Name is
Exfoliative toxin?
Yeah,
toxin.
Exfoliative, yeah.
exfoliative. And how does that exfoliative toxin work?
By dermis from epidermis, it,
Yeah,
it
it's a
damages desmolysin. There's something
yeah,
desmolysin.
it's a protease which break down the desmoglein in the desmosome of the skin layer, right? So correct option is
D.
yeah, correct. So we have these exotoxin, which act as proteases and cleaves the desmoglein and desmosome, which are junctions that adhere epidermal cells together. Scan damage occurs, the exotoxin spread, cause inspiration of keratinocytes and superficial epidermal blasting.
So what is the option?
Yeah, it's exotoxin mediated scan damage.
Okay.
Yeah. All right, next question. Who is going to read this one?
I'll go. Infection with which of the following organisms is most likely responsible for this patient's current symptoms? A 64-year-old man comes to the emergency department due to worsening left lower extremity pain, swelling, and redness over the past 3 days. The patient has had no trauma but reports feeling feverish. Medical history is significant for hypertension and obesity. Temperature is 38, blood pressure 130 over 86, the pulse is 92, respiration is 18, BMI is 35. Physical examinations shows diffuse erythema extending up to the left mid-calf with the indistinct border. There is increased warmth, tenderness, and edema of the left leg. No areas of fluctuation or purulent exudate are present, but the interdigital skin of the feet is macerated and fissured. Laboratory testing shows neutrophilic leukocytosis, and Doppler ultrasonography is negative for DVT. Infection with which of the following organisms is most likely responsible for this patient's current symptoms?
Uh-huh. So what do you think
Um,
this patient is?
Cellulitis.
Yeah, the patient has cellulitis because there is fever. Um, Also, there is increased warmth,
swelling and
tenderness,
redness.
and edema of the left leg, okay, which is the characteristic sign of cellulitis. Also, sometimes there is leukocytosis, which this patient has, okay. So, cellulitis is caused by which bacteria?
Hmm.
By
GBS.
beta hemolytic.
Biogens.
Crocus.
of the
Sorry?
skin, especially.
Group A.
Yeah, group A, beta hemolytic streptococci, right?
Really? Not the staph, especially with the interdigital this.
No, there is no staph aureus in our option.
There's no stuff, no?
Yeah, epidermis. It's oh yeah, epidermis not coming with this. Okay, yes, I get it.
Yeah.
Yes.
All right, next question. Which of the following is the most likely function of this bacterial cell wall associated protein? A microbiologist studying the structure of and function of bacterial cell wall in experiment group A streptococci are treated with a chemical to solubilize the cell wall. Various cell wall associated proteins are subsequently extracted. Electronic microscopic evaluation of a specific protein shows structural homology with mammalian tropomyosin and myosin. This protein acts as a viral specter for certain species of the organism. Which of the following is most likely function of this bacterial cell wall associated protein? So what do you think?
It's again
Yeah,
Streptococcus pyogenes with
I think the M protein.
Sorry?
M protein.
The M
Yeah.
protein.
Yeah, they are talking about the M protein associated
Yeah.
with which bacteria?
Strep
It's
pyogenes.
Pfizer.
Okay, and what's the function of M protein?
Phagocytosis. I think it resists
Yeah,
phagocytosis.
yeah,
Inhibits phagocytosis.
it
Yeah.
resists phagocytosis because it has structural similarity with the M protein of
Resist
erythromycin.
phagocytosis. Yeah.
That's the correct option, right?
Yeah.
Yes.
Okay, next question. So who is going to read this one?
Okay, I'll read. Hold on. Sorry, I have my cell phone. Okay, phys- physical examination of the affected limb is shown on the image. It's the skin overlying the rest of the body appears normal. Which of the following is the most
likely cause of this patient's current presentation. An 8-year-old boy is brought to the office due to low extremity skin rash for the past 3 days. The rash began as tender papules that quickly progressed to form vesicles and flaccid bullae that rupture easily. The patient has no mucosal lesion and has never had similar symptoms before. He is up to date with recommended vaccination and takes no medication. Physical examination of the affected shoot. Physical examination of the affected limb is shown on the image.
Mm-hmm. Okay. So what do you see in this image?
It's impetigo, right?
Impetigo.
Honeycrusted lesion.
Yeah. And
Right.
most specifically, it's bullous or non-bullous impetigo.
Bull,
Bullous.
bullous. Bullous.
Yeah, it's a bullous impetigo, right?
Yes.
Okay. So there are two types of impetigo. One is bullous and one is non-bullous.
Yes.
Both are actually caused by Staph aureus, but non-bullous is also caused by group A Streptococcus or Strep pyogenes. But in these questions, we have the bullous impetigo. And so now looking at the options, what do you think is the most reasonable option?
C.
C. Desmoglein cleavage.
Mediated epidermis.
Yeah, bacterial
Is it
toxin
B?
induce desmoglein 1
Is it clear?
cleavage, right?
Yes. Bacterial toxin.
The exfoliator toxin causes this. All right. Oh, we have these desmosomes. Um, all right. Okay. We have two types of impetigo, bullous and non-bullous, right? Non-bullous is caused by both Staph aureus, most common group A Streptococcus, and bullous is caused by Staph aureus. Mechanism is skin disruption, invasion, and general inflammatory response. And bullous, we have exfoliative toxin that destroy. Clinical features will be papule pustules, honey color crust. Honey color crust is um, more characteristic of the non-bullous group A Streptococcus, negative Nikolsky. Vesicle, flaccid, bulletin, brown crust, positive Nikolsky sign. Complications are group A Streptococcus, PSG, and Staph aureus, um, scarlet skin syndrome. Okay. All right. Next question. Who is going to read this one?
An increased use of which of the following is most likely the underlying cause of the observed trend? A group of researchers collected demographic and clinical data from multiple hospitals across the nation to determine epidemiological features of nosocomial bloodstream infections. In this study, a nosocomial bloodstream infection was diagnosed if blood cultures drawn 48 hours after admission yielded a pathogenic organism. Analysis of the data collected over several decades shows that staphylococci are increasingly responsible for the identified cases, and increased use of which of the following is most likely the underlying cause of the observed trend?
So, what do you think is the correct option?
C.
No, they're asking about the uh,
The
nosocomial.
nosocomial, yeah. I think E. Indwelling urinary catheters.
That
No,
is
F. F. Vascular catheters.
Nosocomial bloodstream infections. Staph aureus.
Sorry?
Intravascular catheters. F.
F is Staph aureus.
Yeah, it's Staph aureus, right? So we have intravascular catheter, and Staph aureus is most commonly found on the skin. So with intravascular catheter, they are going to be predisposed to infection by Staph aureus, right? So the correct option is intravascular
F.
catheter on the F, right? And indwelling catheter increases the risk of urinary tract infection, especially in staph epidermidis. Okay, so we have intravascular catheter, the right option. Okay, I was going to read the next question.
Which of the following is most likely mechanism for the patient condition? 8-year-old boy is brought to the office for rapid and irregular movements of his hands for 1 week. His parents say that he's also making unintentional funny faces and has trouble controlling the volume of his voice. His temperature is 1 or 2. Physical examination, the boy moves his hands frequently and erratically. He has a new 3 by 6 systolic murmur and several circular fainty erythematous lesion on his abdomen. Which of the following is most likely mechanism of this patient condition? So,
Okay, so what condition this patient has?
Rheumatic fever.
Yeah, rheumatic fever. The Selden Hans school, yes, he has right. So correct option is
B.
cross-reactivity of antibodies against bacterial and host antigen is the correct option, right?
Yeah.
Okay, next question.
The decision is initial empiric treatment should include which of the following antibiotics? 62-year-old man who underwent mitral valve replacement 1 month ago is being evaluated in the emergency department for low-grade fevers. He has some malaise and dyspnea. Multiple sets of blood cultures are drawn, and within hours, all bottles grow gram-positive cocci in clusters that are catalase positive and coagulase negative. The decision is made to begin empiric antibiotic therapy. Initial empiric treatment should include which of the following antibiotics?
Mm-hmm. So which organisms the patient is predisposed to?
epidermidis.
Staph epidermidis.
Pyramids.
Okay, what's the treatment of staph epidermidis?
Vancomycin.
Vancomycin.
Yeah, we saw that in the sketch video. We have Van standing over there, right? So we give vancomycin is the treatment of choice for the staph epidermidis. Alright, next question.
Which of the following would be the most helpful in determining the need for antibiotic treatment in this patient? A 10-year-old boy is brought to the office due to abrupt onset, abrupt onset and sore throat that began a day ago. He has similar illness in the past, which were treated with oral antibiotic. The patient has no other medical condition and has received all recommended vaccinations. The temperature is 38.3. The physical examination shows edema of posterior pharyngeal wall and enlarged tonsils, which are covered by white exudate. There is no enlarged cervical lymph nodes. Throat, throat swab specimen is obtained. So the following would be most helpful in determining the need of antibiotic treatment in this patient.
Mm-hmm. So what condition the patient has?
Pharyngitis. Strep pharyngitis.
Pharyngitis, strep throat.
Yeah, strep throat, pharyngitis caused by gas, right? Group A
Group A
streptococcus.
stress. E.
Yeah.
Anti-streptolysin
The
O
Um,
antibodies.
no, the correct option is actually
E.
option E, swab
Strep.
immunoassay for streptococcal group A antigen, right?
yeah.
Streptolysin, it could
Will
be,
take long time.
but it actually takes some time, like some weeks to And then we titrate for the anti-streptolysin or antibodies, right? So the correct option is swab immunoassay for streptococcal group antigens. Did you guys understand?
Yes.
Yes.
All right, so this was all for today. And hope you enjoyed the session. Do you guys have any questions?
No. Thank you,
Sir,
doctor.
sir, can you please provide the PDF with question stems in it? Because the one that you sent on the group does not have it.
I'll send you today's question IDs, but as I already said, uh, it's actually difficult to make a schedule for the microbiology since it's scattered all over the systems. We have
I mean, we just want to get the questions that you just
yeah,
you
I'll
covered
send
today.
you. Yeah, I'll send you that. I do have those. But we have not made a whole schedule for the whole microbiology since there are 300 questions and we want to do the questions related to each topics, right? So maybe each day we could be sending this prior to the lecture. We'll be sending you the daily question IDs. Okay.
Yeah, that would be good, please, sir.
And sir, please to upload the recording of today's lecture on YouTube.
Sure, I'll upload the recording.
Yes, please. If we can get it today, that would be good.
Yeah.
And Dr. Ali, regarding the timing, so
Mhm.
tomorrow we'll start at which time?
Yeah, I actually discussed this with the team, but like the timing has changed. So the September batch class has shifted, and they're like if we start, so there are students enrolled in the September batch who are actually
So,
in the.
but it gets very late at night in Pakistan. It gets 12
Yeah, I
night.
understand, but like uh, since the timing has shifted and we do the class at 12:30 p.m. And for Asian students like India, Pakistan, timing has actually gone
2
1 hour.
p.m. AST was like fine. So, can we not shift it back to that?
No, I mean, he's saying it's because of daylight savings. The time has shifted an hour behind.
Yeah, so now we can start
So,
like at 1 p.m.
so that's why there's an issue with the timing. That's why he's saying that he cannot do anything about it.
Yeah, that's hard. So we have like September batch class at 11, I guess 11:30 a.m. Till around 1 p.m. So if we shift it 1 hour earlier, then it's gonna
But can we not
well,
try to do that? Because, I mean, the
yeah,
students in Pakistan, they will definitely have issues.
I do. I have discussed this with the team, and I told you that we would shift, but there were students who had problems, so we consider this again. I'll discuss with the team. Okay.
The doctor, if you change the time, if you consider to change the time, you have to change for both, for the September batch and the.
Yeah, that's what I'm actually
Yeah.
trying to tell you, right?
Otherwise, we would miss it. Yeah.
Yeah, that's right. All right, so this was all for today. I hope you enjoyed the session. We'll continue our lecture tomorrow and see you there. Have a great night. Take care.
Thank you. Bye-bye.
Thank you, doctor.